Hello, everyone. This is Dr. Val with KBMO Diagnostics, and I'm super excited to announce the launch of our new gut barrier panel featuring relative positive and negative scales. We've been getting really great clinical results since we added the gut barrier panel to the FIT 132 and 176. It's been so helpful and interesting to see who is positive for LPS, zonulin and occludin, and the extra data with the IgA 1 and 2. It's all been really helpful for individualizing treatments for our patients. However, if you're like me, you like more data, and the way the gut barrier panel was like pass-fail. It was just positive or negative. So what I want to know is it an A or a C? How positive is it? How close is it to the cutoff? So KBMO has heard us and changed the gut barrier panel from simple positive and negative to a graded scale for all the 8 gut barrier panel markers. When you're working up your patient for gut barrier permeability, it's helpful to have an idea of what is driving the inflammation that's causing the barrier to open. The barrier opens for a reason. The immune system wants to fight a war and it needs to move troops into position. This is an essential function, but should hopefully be really short-lived. If the immune system has determined that wheat is an enemy combatant and it gets daily exposure, then the inflammation does not resolve and forms what is essentially a chronic wound. Lots of bad things happen when non-resolving inflammation is present in the body. So the treatment strategies for this are always to remove the inflammatory triggers, be those foods or microbes or both, and hopefully before the patient's own body becomes an inflammatory trigger. When this happens, you want to remove the triggers you can remove and soothe the gut with nutrients and anti-inflammatories and good probiotics. We can talk more in detail about protocols for this if you want to reach out to me through KBMO.